And really, I don't have a formal presentation, but I'll tell you a little bit about myself. And then I will talk to you about the different types of research that I am involved with. So first of all, I'm Dr. Jason Beaman. I'm the chair of Psychiatry and Behavioral Sciences. I'm a psychiatrist, forensic psychiatrist, addiction medicine doctor, and a family medicine doctor. Board certified in all of those areas, and hopefully soon to be board certified in clinical informatics also. I have a master's degree in forensic sciences, and I have a master's in public health from Johns Hopkins. So my research interests are varied and wide, and really kind of keeps me occupied in a lot of different areas so I don't get bored. I see patients just about every day. I see patients at OSU Medical Center, and then I see patients at our OSU Psychiatry Clinic and supervised residents at our addiction hospital at 12 and 12. And so I'm just going to outline how my research interacts with all of those different areas. So the first big area of research is what I would just call data. That there are a lot of data sets. Some of them are publicly available and some of them are private. And those data sets contain a lot of information. And so I am looking at obtaining those data sets. Some of them I already have, and then analyzing them. For example, we built a web scraper that every day goes to the Oklahoma Supreme Court, the Oklahoma State Courts Network. If you've ever looked up yourself to see if you've been charged with a crime or married or divorced, we built a web scraper that every day scrapes all of the data off of that and allows us to search it for homicides, homicides around the state and different types of homicides, divorce in different zip codes around the state, armed robberies, methamphetamine arrests. And we're doing that going back to 2010. So we've got 10 years of data that's regularly updated that allows us to see where crimes and other things are occurring almost to the zip code level in Oklahoma. Well, we can take that data and we can merge it with other data. Like if you were arrested for methamphetamine, what is the chance that you overdosed within the next 12 months? If you were arrested for, or if you were treated for opioid addiction, what was the chance that you were arrested in the next 12 months for petty crimes? Or what were the most common crimes that you were arrested for? So really large scale data analysis. Every data set has its own set of questions that can be answered, but then also when you put two data sets together, you start to get a real powerful analysis of what's going on at the zip code level in Oklahoma. We're doing it by zip code, we're doing it by county, by tribal nation, by state legislative district and state senate district. So we've got mathematical computations that allow us to quickly take any metric and either take it all the way up to the tribal level or all the way down to the zip code level. One of the most exciting data sets that we've created is what I call the ACEs surveillance system, where we have mapped all of the adverse childhood experiences. There's 10 of them, and we've mapped those over a 10-year period to every zip code in Oklahoma. So I can tell you exactly what zip code has the worst adverse childhood experiences total, but then also we can break it down by the individual ACE. So which zip code has the most child abuse, which zip code has the most parental incarceration. So we're working on that. We think it's going to be very useful for state agencies. We've just kind of completed it, and so we're polishing it up. But there's all sorts of analysis that can be done with that data set. Other things that we're looking at in regards to data would be a project I'm calling Tulsa Homicides. that if we looked at every homicide that occurred, that was charged in Tulsa, that we would systematically extract data from those incidents, such as age of the victim, age of the defendant, what was the charge of the defendant, what was the race, what was the punishment of that individual, what was the relationship between the defendant and the victim, and how long did they know each other, where did the murder occur, was it a resident, was it a stranger murder, was it a gang-related murder, a domestic violence-related murder? All of these different things. There's also a kind of evil scale of 26 points, and we would try to map each murder on a scale of 1 to 26 on how evil it was, and would create a very powerful, systematic, statewide, well, first of all in Tulsa, but then we take it statewide, data set that would let us know a lot about homicides as they are occurring during in Tulsa. We think that that could be huge. And then we're also looking at creating a social determinants of health database for Oklahoma. This is, you know, there's biology, and then there's genetics that dictate your disease state, but also social determinants of health. How much access do you have to healthcare? Do you have a grocery store within a mile? How many miles of sidewalks do you have in your neighborhood? What's the tobacco sales in your neighborhood? What's the noise pollution? And this is going to require an army of medical students to help us literally walk the sidewalks of Tulsa and help us map out sidewalks and post offices and schools and all of that stuff. But would be the first kind of city, county-wide created social determinants of health database that could then be used to calculate a score for an individual patient, so that when they come in, we ask them, what are you here for today? But we also see that they live in a high-risk neighborhood, and we should offer them case management or something like that to get better outcomes. So those are my, my data research projects that we're actively working on. Before I go on to any others, I'd like to stop and take a break and see if you have any questions or comments about that. Not everybody at once. I'm perfectly fine with awkward eye contact too.
Yeah, so do you guys report like your findings to, say you find something kind of out of the ordinary, would you report those to like the police station, or do you guys not do, like, do you guys not work with like police officers?
So we actually have very good relationships both with Tulsa Police and Tulsa County Sheriffs. We have a data agreement signed with Tulsa Police Department, and I think they would be very involved. But yes, the whole purpose of what I'm doing is to try to prevent crime. And I think giving police officers information, I think would be very helpful. Yeah, so we work very closely with that. Also, we regularly report our findings to the State Attorney General's office, to the State Department of Mental Health and State Department of Health.
Very nice, very nice.
Yeah, we want as many people to know about it as possible and try to be as helpful as possible to the state so that we can make it a better place to live. So valid concern and good question. I appreciate you asking. Other questions? All right. Well, then I will go on to the next area, which I'm just going to call biometrics. So I am getting ready next week to start a clinical trial on utilizing a smart mirror, a mirror like you would look in when you brush your hair, that has Amazon Alexa built into it. So this mirror can ask you questions. And we're going to start it in our psychiatry clinic, where it asks patients about their depression, with the goal of then taking it home with them, or a box that's similar like that. And the box would ask them questions at home, push the answers to their questions to Amazon's cloud, and I would be able to pull it down off the cloud see that their depression is getting worse, increase their medication, and without them ever having to come see the doctor, right? And then repeat again in a month. So really getting into home-based metric assessment to increase access to care, to decrease barriers, and also to increase algorithmic evidence-based treatment of mental disorders. We think we'll get better outcomes that way. We're starting with depression, but we rapidly think that we're going to move into anxiety, OCD, and addiction. We are also getting ready next month to start a postural analysis of individuals in recovery from substance abuse. So we work at a local addiction hospital here in Tulsa called 12 and 12. And 12 and 12 is inpatient rehab. And we painted a wall green, like you would see with the weatherman. We've got Microsoft Connect, which is the Microsoft version of the Wii, and it can measure body movements. We've got a computer scientist in Stillwater that is going to use that to measure posture in individuals on the day they come into treatment, in 2 weeks, and then the day they leave treatment, to see as you get your energy, your self-esteem, your confidence back, if you don't stand up taller. And then can we use posture as a measure of relapse? Going back to the smart mirror I told you about, imagine if you walked in front of it, it automatically measures your posture and say, Jason, it looks like you may have relapsed. Would you like me to call your sponsor? Would you like me to schedule you an appointment with your doctor? Something like that. Again, trying to make things automatic, increase access, and break down barriers. And then the last area of research is something I've been working on for a long time, and we think it's just now getting the steam, and I think is really going to be kind of my life's work. And this is, we have created a typology validation, or let's say reliability testing system, that when someone commits a crime, we like to try to figure out why they committed the crime and try to assign a quote motive to it. And you may have heard the motives for murder are like lust and revenge and robbery and jealousy. And so people come up with motive scales all the time, right? They hear the reasons why someone commits a murder, or commits a mass murder, or commits a rape, like the power control rapist. The problem with all of those motive scales is they have not been tested for inter-rater reliability. And so what we have done is created a typology of mass shootings, and we've carried out the first inter-rater reliability study on the motives of mass shootings. We did that, kind of exploratory at first. We learned a lot, and now we need to change things and repeat it. And we are looking for, again, an army of medical students to help us perform that study. And basically, the students can work in different areas. One area is just researching mass murders. And you do it in a very systematic way. We give you the search terms. You go to Google, you pull down the first 2 pages, and then you put it in a Dropbox. It's that easy. The second area that a student can work on is taking all of that information that the other students have found on Google, and then typing up a 1 to 2 page synopsis of that mass murder, that it occurred on this day by this person, and just facts, no opinions. And then the third would be students, we need about 10 of them, to read all of those synopses and then answer questions on a Likert scale. On a scale of 1 to 5, how closely do you think this murder fits this motive? And we did that with board certified forensic psychiatrists, got really good results. Now we want to tweak stuff and then do it with medical students, because we'll be doing this several times. At the same time we're doing mass murders, we'd like to repeat the same pathway for parents who murder their children. And we've got a database of events. We want students to go and look those events up through news sources, write a synopsis, and then enter in their validation of how it fits this typology. After that, we're going to look at other crimes such as robbery and sexual crimes, and really keep tweaking it. But I do believe that OSU would own the typologies of crimes, because we would have the scientific methodology to go behind it. So those are my projects. Always looking for students, either on a research rotation or, and it doesn't have to be comm students, it can be forensic science students or others, and it can be spread out over a period of time. I recognize that you're involved in coursework, and we can titrate up and down based on your schedule. And with that, I'll open it up to any questions or comments. Anybody at all? Dr. Vassar?
Dr. Beaman, how would you like students to get in touch with you or to become involved in your research?
Yeah, you know, I like everything to go through the Office of Medical Student Research so that the office knows what's going on. But students are welcome to email me directly. And my email address is, I'll go slow, Jason, J-A-S-O-N. I'll give you a second to get something to write with. Actually, I will just chat it. How does that sound? Let's go here. It is jason.beaman@okstate.edu. Thank you for that, Dr. Hartwell. Other questions? All right. Well, then I thank you all for coming, and hopefully we will find ways to work together. Dr. Frucci, do you have a question?
I do. Are you going to be able to go backward as far as to determine your pattern analysis, say from, is there a time frame that you can bring data in from, say 10, 20, 30 years ago, whatever's available?
Yeah, so I think we're looking at like a 50-year period possibly. And we have already, there's a pretty prominent child murder that happened in, well, family murder that happened in McAllister in the 50s, was actually a cardiologist. And I'm blown away by the fact that McAllister had a cardiologist in the 50s, but they did. Turns out he was a mass murderer, so there you go. But we actually, I sent a grad student down to the courthouse, and they got all the original police reports and whatnot. So we're looking to really build a solid data set that then we could make available to other researchers also. So yeah, we're willing to go back, but you know as much as anybody that there's limitations to how far you can go back. And it's shocking that there was a murder of like 30 people that we know very little about. But we're gonna just do the best we can.
Yeah, it's difficult because if the investigation was like some of the cases wasn't done very well, and it's garbage in, garbage out, basically.
Yeah, which is data analysis in a nutshell.
Yeah.
That, you know, garbage in, garbage out.
That's awesome.
Yep. All right. Well, thank you all for coming, and please don't hesitate to reach out if you'd like to work on one of my projects. I appreciate it.
Thank you, Dr. Beaman. We appreciate your time. Thank you for talking to
Thanks,
us.
everybody.
Thanks, Dr. Beaman.
Well, thank you, Dr. Beaman.